Where does fat come from in your diet? To answer that, we have to go over the 4 main types of fat. So we have unsaturated fat, polyunsaturated fat, monounsaturated fat, and trans fats. Saturated fats tend to be solid at room temperature, so think things like butter, coconut oil, animal fats, and full-fat dairy. If your intake of these are too high, it can increase your risk of cardiovascular disease, but that topic is a gigantic bag of worms, so we'll save that for another video. And then unsaturated fats tend to be liquid at room temperature. Think things like oil. Again, we hear a lot of talk about types of fats being good or bad. Saturated fat is bad, unsaturated fat is good, but just like I said earlier, our bodies and nutrition are way more complicated, so let's keep talking about the specifics. So to complicate things even a little bit more, unsaturated fats are broken into 2 categories. We have monounsaturated fat and polyunsaturated fat, and then polyunsaturated fat are broken down into 2 categories, omega-3 and omega-6. First, omega-3s. They are anti-inflammatory. They act just like aspirin does. They inhibit the enzyme that produces the hormone that triggers inflammation. These fats tend to have the strongest evidence for positive health benefits. They can help lower the amount of fat in our blood, our triglyceride level. They can help reduce blood pressure. They can keep our blood vessels elastic, which is really important for preventing cardiovascular disease. And they're critical for the brain development in utero. Remember the DHA I mentioned earlier. So this brings us to another really good example of why nutrition is never just good or bad. Red meat, like beef, is high in saturated fat. A lot of times saturated fat is considered to be bad fat. However, if you compare something like a conventionally raised grain-fed beef compared to a grass-fed beef, the grass-fed beef is going to have a lot more omega-3 fatty acids compared to the grain-fed. But a takeaway would be when you have animal products, especially meat, trying to get grass-fed and pastured meat is going to help increase your omega-3 fatty acid. So there are 3 main types of omega-3 fatty acids. We have DHA, EPA, and ALA. ALA, which is alpha-linolenic acid, is found mainly in plants like walnuts, flax seeds, soybeans, canola, and chia seeds. Whereas EPA and DHA are found mostly in fatty fish, so things like salmon, tuna, herring, mackerel, and sardines. One big misconception about omega-3s is that they're all 3 the same. EPA, DHA, and ALA all have very different roles in the body. So if you're a vegan, you're not really getting any EPA or DHA in your diet, so you should supplement. If you're open to it, supplementing with a fish oil, or you can also supplement with a microalgae oil. If you're eating plants, you're probably getting a decent amount of ALA, but if you're not eating fish, then you're not getting the EPA and DHA, which are very important. So if you're not a vegan, the easiest way to make sure that you're getting enough of these omega-3s is eating fish 2 times a week. So 1 serving is about 3 to 4 ounces. So think like the size of your palm, and that's 1 serving. Ideally having that at least 2 days a week and focusing on those fatty fish that we talked about, like the salmon and tuna and herring and sardines. If you have questions about if you should be taking a fish oil supplement instead of just eating fish, I made a video previously on that I'll link in. The other polyunsaturated fat are the omega-6 fatty acids. These are mainly found in plants. Most of us have our biggest intake from the industrial seed oil, so things like vegetable oil, corn oil, soybean oil, canola oil. We get a lot of intake of these oils because they're used in the processing and packaging of a lot of our food products, so things like chips, baked goods, fried foods, frozen foods. But omega-6s are also really high in nuts and seeds. There are no specific guidelines of how much polyunsaturated fats you should have in your diet, but the ratio is important. Most Americans get way more omega-6 fatty acids compared to omega-3. Usually it's in a ratio of like 10 to 1 or 50 to 1, so a lot more omega-6 than omega-3. This ratio ideally should be closer to 4 to 1 or lower. So to get this ratio, we just want to reduce our omega-6 fatty acid intake and increase our omega-3 fatty acid intake. So the easiest way to do that, to reduce omega-6, is to try to limit those processed packaged foods as much as possible that have the vegetable oils in them, and try to increase your amount of fish intake.